In addition to certification for military caregiver leave, there are other circumstances in which an employer can request a document or form to be completed to support a request for an FMLA leave. This certification lets the employer get information about the leave request and verify that the employee or their family member has a serious health condition. If certification is requested, it's the employee's responsibility to provide it, and FMLA leave requests can be denied if the requested certification isn't provided. An employer can request certification if FMLA leave is requested for an employee's serious health condition, the serious health condition of a family member, or for military caregiver leave. Employers can't request certification for leave to bond with a healthy newborn child or for an adopted or foster care child. If medical certification is required, part of it needs to be completed by a doctor of medicine, podiatrist, dentist, clinical psychologist, optometrist, nurse practitioner, nurse midwife, clinical social worker, or physician assistant. Requests for medical documentation must be provided to the employee in the written Rights of Responsibilities notice given within 5 business days of the request for FMLA leave. Employers may request the documentation at a later date if they have a reason to question the appropriateness of the leave or its duration. Employees must also be told the consequences of not providing the certification at the time of the request. Employees have 15 calendar days to provide the requested medical certification. This time can be extended if a good faith effort to get the documentation can be shown. A completed medical certification should include contact information for the medical provider, when the serious health condition began, how long it's expected to last, the likely duration of the leave, and any appropriate medical facts about the condition. These can include symptoms, doctor's visits, and diagnosis. An employer can't reject the certification form if a diagnosis isn't given, as this is left to the discretion of the healthcare professional. Medical certifications can be provided in any format as long as the necessary information is given. If medical certification is found to be incomplete or insufficient, the employee must be notified in writing and given 7 calendar days to correct the missing information. A certification is considered incomplete if information is missing, and insufficient if the information given is vague or doesn't answer the questions. Employers can only contact healthcare providers directly for authentication or clarification purposes. These contacts must come from human resources or the leave administrator, not the employee's direct supervisor. If the employer has reason to doubt the validity of a certification, they can request a second opinion at their expense. If the first and second opinions reach different conclusions, a third opinion can be requested, and this finding is final. If requested, copies of the second and third opinions should be given to the employee within 5 business days. While waiting for second and third opinions, the employee should be provisionally approved for FMLA leave. If the results determine that the leave doesn't qualify for FMLA, it should be treated as paid or unpaid leave under the company's leave policy. In certain circumstances, recertification can be requested every 30 days if the employee is still absent or is requested to be absent, unless the original certification showed that the leave would last more than 30 days. Employers can request recertification in less than 30 days if the employee requests an extension, the circumstances have changed, or the employer has reason to doubt the validity of the leave.